Hello, and welcome to yet another edition of Wellbeing Wednesday. My name is Dr. Eno Nsima Obat, also known as Dr. Eno, and indeed it's a pleasure to present today's topic. Well, today's topic really pertains to a little known vitamin that I actually found out I was deficient in about 2 years ago and really allowed me to highlight the importance of this vitamin because it kind of is counterintuitive. It's called vitamin D. And just so you know, vitamin D is a very important vitamin in our diet, and we get it from the sunlight as a natural source. So it was hardly surprising that, given that I was always promoting sun protection when you were out, that I was deficient in vitamin D. And so I began to really, um, you know, highlight this not only to my patients, but also did some research on the benefits of vitamin D and how it helps our overall well being. And also bringing this to this platform to alert you to the fact that if you are not already aware of your vitamin D level, you really want to take the time to have that discussion with your physician. So, what is vitamin D? First of all, vitamin D is a fat soluble vitamin. In other words, it is produced in the fatty tissues of our body. It's produced by the combination of natural sunlight and has many functions. The most common function that people are aware of is that it helps with healthy bones. But more importantly, vitamin D takes part in many of the metabolic functions of the body, going all the way from our mood to helping to prevent things like diabetes to cancers. And so it's very important to be aware of your vitamin D level because this will help your overall sense of well-being. Now, how do we test for vitamin D? It's a very simple blood test that can be performed by your physician or your healthcare provider. There are also home test kits, but I usually recommend having your testing done by a healthcare provider so that it can be interpreted appropriately and you can be put on the appropriate dosage of medication. So get a test done by your physician, make sure you follow up and know what your level is. And there are different levels of vitamin D supplementation. So depending upon how severe your deficiency is, your primary care or your healthcare provider might recommend a dosage as high as 50,000 units once a week. If you have a mild or moderate deficiency, you may be able to take an over-the-counter daily supplement. So, information on vitamin D, I've attached more information for you to read, also some resources. Get informed about this vitamin, and just remember that even though it is produced by natural sunlight, that you still want to take sun protection. You still want to apply your sun protection during the summer. After the critical hours, which is from 10 to 4:30, you can go out. So, for instance, you can take an early morning walk for about 30 minutes and get your daily dose of natural vitamin D from there. Also, remember one of the natural sources is, for instance, your green leafy vegetables, because vitamin D works very well with magnesium to perform its metabolic functions in the body, and also natural sources like your wild salmon. So, information on vitamin D, go ahead, have a conversation with your physician about your vitamin D levels, and always remember to get a follow-up test so you know exactly where you are. Until next week, here's to your health and well-being. Dr. Eno signing off. Goodbye.